I work in digital health, and the health sector is by its nature very fragmented. You've got a private sector full of GPs and pharmacists and specialists. You have hospitals often run by state and territory governments, and you have programs that are funded by the Commonwealth and some levers there with the Commonwealth. So from the start, it's really hard to get a consistent, connected consumer experience. My job then is all about how to start to fill those gaps, which requires a lot of building relationships, requires understanding the different drivers and forces that industry and governments are working within, and then trying to find a pathway through those. One of the things I love about my job is that health services affect everyone in Australia. The services that my branch designs, builds, work with partners to collate really help everybody. So for example, early in the pandemic, we implemented electronic prescribing, which helps you then to get a script on your phone after you've had an appointment with a GP, for example, and take it to a pharmacy of your choice or send it on to a pharmacy of your choice. Similarly, we worked on the COVID vaccines clinic finder, so you can find, regardless of who's delivering the service, a vaccine clinic with an appointment that meets your needs. So clearly very high priority initiatives that affect millions and millions of people in Australia. One of the key strategies I use is about relationship building. It's very hard in a very complicated policy and program environment with different funding models and different pressures to try and navigate a consumer experience or create a better consumer experience when there's all these competing demands and pressures on the sector and on governments. And so one of my key strategies there is to build really close relationships with the people I need to work with. And so I'll be very on the front foot looking at where governments are heading with their policy directions and some of their new initiatives. And I'll be reaching out to colleagues across government, trying to understand where a consumer experience fits in, and then how can me and my team help to create a better consumer and better connected consumer experience. So all our projects are aiming to improve the health and wellbeing of everyone in Australia. And so it's a very big, broad objective, and one that my team can work with, one that my stakeholders in other governments are working with, and my stakeholders in the private sector. So it gives us a really strong reason for being that helps us to collaborate across the different boundaries that we might otherwise operate within. In creating a better consumer experience, I'll give you a couple of examples. So I've mentioned the vaccine clinic finder, which helped to federate all the vaccine clinic information in one spot. So you didn't need to go to multiple different websites and do the virtual equivalent of phoning different clinics to work out where an appointment was. You could go to one spot and find that. So that enabled access to millions and millions of people. We've had 60 million hits to that site in the 2 years it's been running. But we found that not everybody can access the online channels, and so we made the online channels as inclusive as we could by adding in new languages, information about access to clinics, like whether a clinic has a quiet space, whether a clinic has wheelchair access, and what languages are spoken by the clinicians in the clinic. And so we kept evolving our services digitally there, but supported by non-digital services, including a phone line and later on a text-based service that really helps people in very complex circumstances to navigate the system and find an appointment and get vaccinated. What I've noticed in working through things like vaccines and moving across different departments just inside the APS is that people have often tried to solve the same problems or very similar problems before. And so I think there's enormous opportunity to reuse, at the very least, the skills and experiences people have. Beyond that, some of the products, some of the tools, some of the technologies that people have already built. There's a very easy scope for reuse if you can just tweak 10 or 20% of what's already been done and needn't require to start from scratch. And yet I see that happening probably too often. That's just within the APS. And then if you consider going out to states and territories, there's another 8 jurisdictional governments who've often as well faced the same challenges and come up with similar or even better ways of doing things. And so there is enormous opportunity to collaborate. I think it would help us get to market faster, it would help us learn faster and reduce the cost to government and the taxpayer. Health services by nature have some very sensitive information attached to them. It's spread across multiple places, across primary care, across government systems in states and territories and federal level. Having a coordinated, consistent approach to digital identity will really help to open that up for consumers and do it in a trusted way. And I think that's really important and powerful. I think a digital ID is, again, going to be critically important there. It has to be designed in the right way with lots of inclusion built into it. The trick will also be making sure that the services that digital identity enables are also designed with access in mind. So things like translations of content, things like the right levels of contrast for vision impairment, and all sorts of other ways of digital services, of course, supported by the non-digital services too. And if a digital identity can help to open up that access barrier, I think it's a great thing. I've been here today primarily as a speaker, and it's been fantastic to see so many engaged and motivated people around consumer experience, which is my area of specialisation. And so again, it's been terrific to meet those people, to see their reactions to some of the things we're talking about, and to hear some of their questions.